How did you even build a private health system without external support, without external recognition?
Because of the resilience of the community, we came here from scratch. People built a private sector like their own.
Avi Mini for Rebel News in the Horn of Africa on our special mission for the truth about Somaliland.com. What you're about to watch is another special report from here. And if you support our mission on the ground here, please consider chipping in to help us cover the costs, including our charter flights and our armed security. Damn, this is a safe place, but that makes me feel a lot safer. The truth about Somaliland.com. Check out all our reports, support the mission, and make sure to share the truth. What's the health state of Somaliland? Because we know Africa has major challenges. What's it like compared to the rest of Africa?
From experience working in Africa, which are more than 11 countries in Africa and also in the Middle East, Somaliland health system has been built from scratch since 1991. Currently, the health system in Somaliland needs a lot of funds. There is a lot of complicated things regarding on the health financing, health structures, and also the building blocks of health systems, including medications, supplies, regulations. And compared to other parts of Africa, in other parts of third world, we are trying our best, but we need a huge support regarding on health and human resources, medical services, and also improving the quality of healthcare in the country.
What are the kind of diseases? So we know in Africa there's, some countries worse and more than others have problem with diseases, starvation. What's the main medical challenges in Somaliland?
The main medical challenge, as I'm an emergency medical doctor expert for infectious disease. So the number one cause of common disease at the moment is non-communicable disease like diabetes and hypertension, like Western countries. We have still infectious disease, treatable or communicable disease like pneumonia, tuberculosis, but they are not in the top. We have also alarming cases of cancer, and we need a big research and funds to early diagnose cancer cases in Somaliland. So the cancer is increasing because we are seeing people on late stage, so we need a capacity to be supported for research, and also we need experts who knows cancer. In other diseases like common diseases for pediatric children, we have doctors and it's still treatable. But when it comes on advanced like dialysis, kidney failure, and as well as cardiac surgery, and open cardiac health surgeries, and oncology specialists, we need that to be supported on that field.
It sounds like the challenges here that you face in Somaliland are very similar to the West, rather than what we typically hear from the Horn of Africa. Some of the diseases that we hear that come out of Africa are things that we don't typically see in the West. Why is it that here you're not getting, those other sicknesses that everybody, when you travel to Africa, you've got a list of vaccinations that are recommended. Why don't we see that here so much?
It depends on the geographically where we are. I used to work in West Africa. I used to work in Nigeria.
And what are the diseases that they have there, just for people to understand?
Yeah, because some of the countries in part of South Sudan have frequent cholera outbreaks like that. So we don't have water at the moment, and the sanitation of here is very good, and also the climate helps. The climate of here...
The climate in this particular part of Africa is better for health.
Yeah, but here as well, apart from I think the living conditions also matter. If some of the countries, the people gather together and then they have sometimes contact each other from tuberculosis, they live in crowded areas. Here people live in good manners, in good areas. I can compare sometimes in Yemen and in Somaliland. So, and we can get a lot of not polluted air, no pollution, and apart from sedentary lifestyle, people doesn't do exercise more. So that's why they come up with diabetes and also hypertension. But when it comes on the infectious disease, we don't see outbreak cases like diphtheria, who kills children. We don't see. We have cases of measles for children, but still we use the program of immunization. It's called the Essential Program of Immunization (EPI). We have also a functioning system of program of vaccination in the country. But the specification of we need health education and health advocacy regarding on people to know their health systems.
If you had to compare Somalia's medical infrastructure, Somalia's healthcare system, in comparison to Somaliland, which one is better right now?
Oh, when it comes on the comparison, Somaliland have a lot of infrastructure health systems being built and accessible and safety as well. They have also their own, and when it comes in quality, people go safety areas and peaceful where they can access and go. But the quality is different. But Somaliland is much better than that.
Somaliland is so this is my point. Somaliland has already a much better healthcare system than Somalia, which does get all the international aid that is internationally recognized. So my question is, if Somaliland was recognized, would that not become a five-star healthcare system if they managed to get it better than Somalia, even being unrecognized?
Excellent. And if we go back to Somaliland government, there's a called Abuja Declaration of Health Financing. We get 5% from the national budget. So it's $12.5 million for the whole Ministry of Health functioning, which is very minimum. It cannot also pay the staff. So if imagine we get aid of our external, like global funds, like UN funds, I think this will be dramatically changed. It will be different by this time. Yeah.
You wouldn't even be able to compare. It would be a different league. But instead the world is throwing money and recognition at a failed state while ignoring a state like Somaliland that could be a success story even in health.
Yeah. The Somaliland, I also wrote a lot of papers regarding on the Somaliland health system. So it will be success stories regarding on, there will be a dilemma regarding on some countries become the donors fatigue. They call it donor fatigue system. The donors are fatigued and tired for giving, like give Somalia a lot of money and there's no outcome. There's no future. They don't see a change. But if funds was being given here, things will be different and things will be look like a different. And minimum standards regarding on the staffing, on what is called in health financing, it will also improve the quality of both community level and also on the standard. We can be competing with like Rwanda health systems, like Kenya. Kenya is one of the leading eastern part of Africa when it comes on the system. Ethiopia, our neighbors, are also doing their best because they have also 120 million population and Kenya have 46 million population. When it comes on the specialities, we have 6 million population for 10 doctor radiologies. We have around 100 surgeons at the moment. So we are just doing our best. We start from scratch. And our student, we are better than some countries like Burkina Faso, Guinea-Bissau, Chad. I was there. So when it comes on manpower, we just do our own, which is successful stories.
So I was talking to some of the political figures here. They're saying they don't want aid. They don't want aid like the rest of, much of Africa. They just want to be part of the international bodies so that they can run their own country and have their own thriving economy and the international stage. Is the medical world, is the health system here the same? Is it something that if Somaliland was recognized, are you confident that the health system here could run on itself successfully?
Excellent question, a very interesting question regarding on once the health system in Somaliland, if we have been recognized, for example, before 10 years or 1 decade ago, things will be better than here because globally we will be open to the international institutions who support governments, who support regulations. For example, we are a Somalian Medical Association. the umbrella of medical doctors. We are around 2,000 doctors, but we don't have international support. We don't have a link with the global world medical associations. But if we have link or recognize, things will be better, and the system can run itself because of the government. If we get oil or if we get other resources in the country, things will not. We don't need maybe other aid. But as a humanitarian experience for 15 years, still we need, even if we are recognized, we still need like things to improve. We need external like consultancies, expertise who can help us, like other big governments like Israel, like USA. If others experts can come us, they can support and building our health system.
How is the health system at the moment? Can people get urgent medical care, quality urgent medical care?
This is it's a $1 million question, because the quality, the people can access of healthcare. There is a public institutions here. The public health facilities are functioning like big hospitals, like Hargeisa Group Teaching Hospital, like Burao, the second city, and Borama. But we have a huge private sector, so people use out-of-pocket expenditure of health systems. So people buy health, and some of them get the free healthcare access. This is still not implemented well. So the rural parts of the area and hard to reach areas in the country, like in the villages, they have a health centers. So the health facilities people can afford, but still the system in here is private and you should pay.
How did you even build a private health system in a country that hasn't been recognized? It's fully functioning, thriving democracy with peaceful transfers of power and a functioning health system, even if much of it is private. How did you do that without external support, without external recognition?
Excellent. Because of the resilience of the community, these communities, I myself was a refugee in 1989, 90s in Ethiopia. So I remember I was in queue for getting in health center queue because I was a refugee boy. So since then we came here from scratch. People built private sector like their own. So doctors who build the private sector contribute a lot because they also do free care. The poor people, they also contribute the system. So this is self-owned. This is a lot of resilience, commitment, and as well as consistency by the doctors and the people who make the private. So we implement public-private partnership recently. So to partnership with the public and private. The private contributes so much in this health system. And there's no aid, there's no other funds, there's no external investments regarding on private sector as well.
Is there currently, now that you're recognized by Israel, is there a collaboration in the health sectors at the moment, or are they talking about it? What's the plan?
In my experience, and I'm one of the key people who always have networks outside of the country, we hope to link with when it comes on referral facilities, when it comes tertiary hospitals regarding on hair surgery. There's a few people who have been transferred to Israel and Tel Aviv a long time ago for cardiac surgery, heart surgery.
From Somaliland, even before recognition?
Yeah, before recognition. So if it comes, it will be a huge opportunity for us we can transfer, we can send the students, we can change knowledge each other. We can also have knowledge transfer from doctors from Israel to Somaliland as well.
Donald Trump's watching this from a health professional, from a health expert, from the Association of Medical Practitioners here. What would you say to the President of the United States?
I would say if doctors of Somaliland and our professionals, we need huge support regarding on medical knowledge. Somaliland health system was built by British. For British systems help the education of Somaliland, and also they support us from the education of medical practitioners. There's a clinical scholar, there's Tropical Health Education Trust who helped my teachers when I was 11 years ago. My doctor teachers coming from all the way to London and Liverpool. So if we get like similar, we have also linked with Australian Medical Association.
With Australia?
Yeah, they were coming from all the way to Australian doctors for Africa. They come in here. They have surgeries in the hospital. So we need the American Medical Association to come and support us.
So there is a connection with Australia at the moment between the medical.
Yep.
Why doesn't Australia recognise Somaliland then?
That's a political question. I don't know, but we have more than the last 15 years. The Australian medical doctors for Africa were coming here, and they were supporting us, and they were teaching us. They were supporting orthopedic and surgeries on fractures, and they helped the University of Hargeisa and Amul University. We have a lot of connections regarding on Australia and UK.
If you enjoyed this report, make sure to like, comment, share, then head over to thetruthaboutsomaliland.com. Check out all our reports, our interviews, our stories from here in Somaliland. Then make sure to sign and share the petition. And finally, if you support our mission here on the ground, please consider chipping in to help us cover the costs. They were exuberant. We're talking about charter flights, travel, fixes, security, food, everything. Cost a lot more than we thought, but I think it was worth it. TheTruthAboutSomaliland.com. It's all there.